presentation. Case presentation is the method of presenting the images and related details of an ultrasound study to the interpreting physician, and state the type of examination and reason for it. And present patient history. And relate patient's lab data and any other known core relative information such as reports and films from other imaging modality studies. And present documentation in the sequence it was taken. Be capable of justifying your technique and procedures. Be able to describe the ultrasound findings using appropriate sonographic terminology. Clinical correlation. Sonographers held a unique position among other allied health professionals specializing in imaging modalities because sonography is operator-dependent. The images are only as good as the sonographer taking them. Scanning competency is not certified by Registry of Licensing, so it takes personal initiative and discipline. 19 Judge proficiency and master scanning skills match the quality of your images with established ProSes images and use feedback from your instructors, clinical peptin and/or physicians to help monitor your interpretive report. When the ultrasound examination is completed, the sonologist, usually a radiologist, always applies CISION, provides an interpretive report and RIPON that includes a detailed description and diagnosis of the ultrasound findings. The rendered diagnosis may be a definitive diagnosis or a differential diagnosis that includes multiple possible pathologic conditions indicated by the ultrasound findings, figure 1.13. A copy of the final report is sent to the requesting physician. A copy goes in an inpatient's chant OFEM, and a copy is kept in the patient's ultrasound file. Diagnosis. Findings compatible with complete spontaneous abortion, sclepa praegrancy, or very early intrauterine pregnancy. Comment. Real-time ultrasound off pelvis was performed using transabdominal and endovaginal technique. Previous studies are available for review. The patient has a positive. The uterus measures 10,949 to 50 cm. No intrauterine gestational SAC is identified on transabdominal of. The fell ovary is enlarged, measuring 422,996 centimeters. A cystic structure, measuring less than 1 centimeter, is seen in the fetal age. The right ovary measures 2.6 times 1.1 by 2.66 m. There are no right adnexal masses. There is no free fluid in the cold S80. In light of a history of positive urine pregnancy test, the differential diagnosis for the above findings includes complete spontaneous abortion, solopal pregnancy, or less likely, very early intrauterine pregnancy. Correlation with serial beta 166 seconds is advised. Survey views of both kidneys reveal no hydronephrosis. With this understanding, it becomes obvious how affiliated body systems can share pathologic conditions. For a sonographer, this knowledge may be the determining factor that leads to further investigation of related body systems during a sonographic examination. The following body systems work independently and together to maintain homeostasis and equilibrium in the body's normal physiologic condition: nervous system, endocrine system, and cardiovascular system, lymphatic system, and musculoskeletal system, and reproductive system, excretory systems, urinary system, and digestive system, respiratory system, nervous system. The nervous system monitors and controls almost every organ system in the body. See Table 5.1. It is divided into central and peripheral portions. The brain and spinal cord comprise the central nervous system, CNS. The peripheral nervous system, PNS, is composed of thousands of nerves that connect the CNS with the rest of the body, muscles, glands, and sensory organs. Together, these systems control most of the body's functions through signaling by voluntary and involunta muscles. They also control sensory areas, sight, hearing, smell, touch, and regulatory areas, the hypothalamus and pituitary gland control of the endocrine system. The nervous system serves as the body's computer responsible for processing data to and from the brain, and thus controlling everything from pain sensation to coordination, from high-level cognitive processing to hypothalamic control of the endocrine system. This is all made possible by the billions of neurons, NEN cells, comprising the nervous system. They have the unique ability to send and receive electrical signals so that they can communicate with each other and with other parts of the body. Central nervous system. The CNS is the processing area of the nervous system, is responsible for receiving, interpreting, and responding to electrical signals from the PNS. The brain and spinal cord of the CNS are well protected by the cranial vault and spinal column vertebrae of the skeleton, which surround these structures like protective armor. Additionally, they are covered by the meninges, the following 3 protective layers of connective tissue: pia mater, innermost layer, and arachnoid, middle layer, and dura mater, outer layer, located against the inner surface of the cranium and vertebrae. Further, the space between the pia mater and arachnoid is filled with cerebrospinal fluid manufactured in the ventricles of the brain, which forms a protective cushion. Peripheral nervous system. The main function of the PNS is to connect the CNS with the limbs and organs, to relay information from the brain and spinal cord to the rest of the body, as well as from the body to the spinal cord and brain. The PNS consists of 31 pairs of spinal nerves that branch off from the spinal cord to supply every part of the body except the head and neck, which are served by 12 pairs of cranial nerves that emerge from the brain. The peripheral nerves carry out voluntary and involuntary actions that are divided between the somatic and autonomic systems as follows. Somatic nervous system. All conscious awareness of our external environment, voluntary, and all movement through skeletal muscle. Autonomic nervous system, not under conscious control, involuntary. Monitors the internal environment and the function of glands and organs. Also, controls the contraction of smooth muscle. Has 2 subdivisions that usually exert opposite effects on the same organs, resulting in a balance between the 2 forces. Sympathetic division responds to stress or impending danger, known as the fight or flight system. Sympathetic signals cause the adrenal glands to release adrenaline in the bloodstream, which stimulates all cells of the body in preparation for an emergency. Physiologic changes occur, such as increased heart rate, breathing rate, blood pressure, and blood shunting to the muscles, all to help the body cope with high-stress situations. Parasympathetic division maintains and restores the body's energy, follows sympathetic stimulation after the danger has passed, and works to return body functions to normal. Parasympathetic signals reduce the output of adrenaline, decrease the heart and breathing rates, and lower blood pressure. Even when there is no crisis to recover from, the parasympathetic signals promote a calm state of being. Endocrine system. The endocrine system is a collection of glands that secrete hormones, chemical messengers, directly into the bloodstream to arrive at target organs. Unlike the nervous system's precise short-term coordination of responses to stimuli, the endocrine system utilizes long-term coordination of chemical signals T-tane homeostasis by regulating body functio-reproduction, growth and development, blood glucose levels, stress response, and OVUI, neuroendocrine system. The endocrine system is often referred to as the neuroendocrine system because the hypothalamus of the brain directs and monitors endocrine functions. The hypothalamus communicates directly and exclusively with the master gland of the endocrine system, the pituitary gland, also known as the hypophysis, which is also located in the brain. The pituitary is a pea-sized gland that sits in a small bony depression of the skull called the sella turcica, Turkish saddle, directly below the hypothalamus. It is connected to the inferior portion of the hypothalamus by a stalk, through which it receives instructions from the hypothalamus on how to regulate the hormonal activity of the other endocrine glands located throughout the body. Table 5.2. Pituitary anatomy. The pituitary is composed of two parts. Anterior pituitary adenohypophysis, gland composed primarily of cells that secrete protein hormones. Posterior pituitary neurohypophysis, actually an extension of the hypothalamus, forming the connex scion or stalk between the hypothalamus and anterior pituitary gland. It is composed primarily of axons of hypothalamic neurons that extend inferiorly behind the anterior pituitary. System functions. Hormones transfer instructions from one set of cells to another. Although many different hormones circulate throughout the bloodstream, each one affects only the cells that are genetically programmed to receive and respond to its message. The hypothalamus secretes hormones transported directly by blood to the anterior pituitary gland. In response, the anterior pituitary releases its own hormones, which travel via the bloodstream to stimulate the other endocrine glands to release their hormones that control specific body functions, thus helping to maintain homeostasis. The posterior pituitary is also stimulated by the hypothalamus to release the hormones it stores. See Table 5.2. Receptors within the hypothalamus monitor blood levels of hormones within the body. When the hypothalamus receives a signal that there is a rise or fall of an organ's hormone level, it sends a message to the pituitary gland, which in turn releases either an inhibiting or releasing HORM1 into the bloodstream. It then travels to the organ and causes it to either stop releasing its hormones or to release more of its hormones to maintain homeostasis. Endocrine glands, their location, the hormones they secrete, and gland location in the body: anterior pituitary gland, brain, posterior brain, pituitary gland, thyroid gland, neck, parathyroid glands, neck hormones, follicle stimulating hormone, FSH, luteinizing hormone, LH, thyrotropin, TSH, adrenocorticotropin, ACH, growth hormone, GH, prolactin, melanocyte stimulating hormone, oxytocin, vasopressin, thyroxine, T4, triiodothyronine, TEAT3, calcitonin, parathyroid hormone, PTH, adrenal glands, mid-epinephrine, hypogastrium, norepinephrine, mineralocorticoids, glucocorticoids, pancreas, mid-insulin, hypogastrium, ovaries, pelvic cavity. Estrogen, progesterone, testes, pineal gland, scrotum, brain, testosterone, melatonin, thymus, thoracic cavity, thymosin gland function, assists in ovarian follicle development in females and sperm maturation in males. Thyroid gland stimulating hormone. Adrenal gland stimulating hormone stimulates growth in general, initiates and maintains milk secretion in females, melanin formation and deposition in the body. Uterine contracting and milk releasing actions, constricts blood vessels, raising the blood pressure and increasing peristalsis, has some influence over uterine contractions, influences resorption of water by kidney tubules, used as an antidiuretic. Responsible for assisting in metabolism of lipids, proteins, and carbohydrates. Their presence can increase the body's need for oxygen, which leads to increased heat production, body temperature elevation, which will influence most tissues. Responsible for removing calcium via absorption. This causes calcium to be removed from the blood and sent to the bones for storage. Basic antagonist for calcitonin. PTH sends a signal, causing bone reabsorption. If the body is low in calcium, it will take what it needs from the bones, adding calcium to the bloodstream. Causes blood glucose levels to elevate. The heart races and major vessels dilate. It also causes ACH to be released from the pituitary, causes diastolic and systolic blood pressure to increase. It is also a vasoconstrictor and causes peripheral vessels to constrict. Control sodium and potassium levels. Control glucose use by conserving consumption, ACH controlled. Controls the uptake use of glucose to prevent glycogen breakdown within the liver, responsible for decreasing the blood glucose level. Glucagon antagonist to glucocorticoids, it increases the blood glucose level. Responsible for female secondary sex characteristics. Released during the menstrual cycle to prepare the uterus for possible implantation. Released during the menstrual cycle to prepare the uterus for possible implantation. Responsible for male sex characteristics. Weakly modulates wake, sleep patterns. Promotes development of antibodies. Stops working after puberty. Note, the number in parentheses indicates the number of attached iodine cells, e.g., thyroxine plus 4 iodine cells. Cardiovascular system. The heart and circulatory system make up the cardiovascular system. The heart works as a pump that pushes blood through a network of arteries and veins. These arteries and veins deliver blood, oxygen, and nutrients to every cell and remove carbon dioxide and waste products made by those cells. The cardiovascular system has WO-specific functions. Pulmonary circulation transports blood from the heart to the lungs and back again. And systemic circulation transports blood from the heart to most parts of the body except the lungs and back again. Arteries and veins. The vascular components of the cardiovascular system are the arteries and veins. Arteries are thick-walled blood vessels that transport oxygenated blood away from the heart. There are two arterial transport exceptions, the umbilical arteries in the fetus and the pulmonary arteries see pulmonary circulation later. Both transport oxygen-depleted blood. Arterial walls are 3 layers thick, which assists blood transport under high pressure. The aorta is the main artery leaving the heart. It is a massive artery extending from the heart to the lower abdominal cavity. Along its course, it gives off branches throughout the body that supply body structures with the oxygen and nutrients they require. Except for the pulmonic and aortic valves, arteries do not have valves. The thick muscular wall in the artery squeezes the blood forward. Veins are thin-walled vessels that transport oxygen-depleted blood to the heart. The umbilical veins in the fetus and the pulmonary veins, see pulmonary circulation later, are exceptions. These veins transport oxygen-rich blood. Venous blood throughout the body ultimately ends up in either of the 2 major veins depending on location, the superior vena cava from areas above the heart, or the inferior vena cava from areas below the heart. These large vessels empty deoxygenated blood into the right atrium of the heart. Blood in the legs would stagnate were it not for the presence of valves within the veins, as well as skeletal muscle contractions to help move the venous blood up through the veins against the effects of gravity. Pulmonary circulation. The venous blood transporting carbon dioxide and cellular waste products must get to the lungs and exchange these for oxygen. The oxygen-depleted blood returns first to the heart via the superior and inferior venae cavae, which enter the right atrium. The coronary sinus empties the heart's veins directly into the right atrium. When the deoxygenated blood enters the right atrium, pulmonary circulation has begun. The deoxygenated blood is then pumped through the tricuspid valve into the heart's right ventricle and flows from there, through the pulmonary semilunar valve, into the main pulmonary artery. Note the exception of an artery carrying oxygen-depleted blood. The main pulmonary artery bifurcates into right and left branches, which carry the deoxygenated blood to each respective lung, where the red blood cells exchange the carbon dioxide and waste for oxygen. The now oxygen-rich blood leaves the lungs through pulmonary veins. Note the exception of veins carrying oxygen-rich blood, which transport it to the left atrium, ending pulmonary circulation. The blood is pumped from the left atrium through the bicuspid or mitral valve into the left ventricle. When the oxygenated blood leaves the left ventricle, it enters systemic circulation. Systemic circulation. Oxygen-rich blood is pumped from the left ventricle through the semilunar aortic valve to enter the aorta, thus beginning the systemic circulation cycle. The aorta arches superiorly to give off branches to supply the upper body before descending through the thoracic cavity and piercing the diaphragm to enter the abdominopelvic cavity. The abdominal branches of the aorta supply the lower body structures with nutrient and oxygen-rich blood. The major branches of the aorta give off their own branches. Those branches, in turn, may give off branches, all decreasing in size to small arterioles and ultimately capillaries. Capillaries are the thinnest and most numerous of the blood vessels. They provide a connection between arterioles, tiny branches of arteries, and tissues for delivery of nutrient and oxygen-rich blood to the cells, and also between tissues and venules, tiny branches of veins. Venules then transport the deoxygenated blood and waste to larger veins, which in turn transport it to the superior or inferior venae cavae, which empty the blood into the heart's right atrium, subsequently ending the systemic circulation cycle and beginning the pulmonary circulation. Atypical blood flow. As previously discussed, the typical pattern of systemic blood flow in organs and body structures is as follows: artery, arteriole, capillary, venule, vein greater than. However, there are 2 unique areas in the body where this pattern does not apply. In the liver, the unusual circumstance is that there is simultaneously free mixing of portal venous blood, oxygen-depleted and containing cellular waste, and hepatic arterial blood, oxygen-rich and containing nutrients in hepatic sinusoids before exiting the liver in the hepatic vein. The kidney is unique because it contains 2 sets of capillary beds, rather than a single set, as in all other areas of the body. The additional capillary bed enables the kidneys to assist the cardiovascular system, if necessary, by maintaining a state of blood pressure equilibrium even when the systemic pressure changes. This is an example of an independent yet related body system, the kidneys, providing protective backup assistance if the primary system cardiovascular function fails. See Table 5.1. The heart. The heart consists of 4 chambers, 2 at the top, the atria, and 2 at the bottom, the ventricles. The heart is a specialized muscle, the myocardium, which contracts continuously, pumping blood to the body and the lungs. Each time the heart pumps, an intricate coordination of events takes place. The pumping action of the heart is not controlled by the brain, rather, it is caused by a flow of electricity through the heart that is triggered by the heart's sinoatrial SA node, the heart's natural pacemaker. The SA node emits regular electrical impulses from the right atrium that cause both atria to contract and pump blood into the ventricles. The electrical impulse then travels to the ventricles through the atrioventricular AV node, which serves as the heart's circuit breaker in case the SA node impulse comes too quickly, causing the muscle to contract and pump blood from the right ventricle into the lungs and from the left ventricle into the body. In a relaxed state, the normal heart rate is 70 to 90 beats per minute. Heart rate is a measure of both sides of the heart contracting at the same time, then relaxing and filling, then contracting again. The pumping or contracting phase is termed systole. The filling or relaxing phase is diastole. The heart beats faster during exercise or states of stress or excitement in response to the body's need for more oxygen. Chemicals circulating in the blood are released by nerves that regulate the heart rate, altering the speed of the SA node and the force of the pumping action. See Chapter 30 for additional information on the cardiovascular system. Lymphatic system. Components of the lymphatic system are lymph, lymphatic vessels, lacteals, lymph nodes, and organs that include the spleen, bone marrow, and thymus gland. The main functions of the lymphatic system include the following: the collection and transportation of excess fluids from interstitial spaces of the body back into the veins in the bloodstream, the absorption of fats from the small intestine, which are then transported to the liver. Immune system functions, which utilize lymphoid tissue and organs to produce the cells that fight and dispose of foreign material. Collection and transportation of fluid. Lymphatic fluid, or lymph, is interstitial fluid consisting of digested fats, water, protein, white blood cells, and tissue waste. Small capillaries drain lymph from the head, abdominopelvic cavity, organs, and extremities into the lymphatic vessels, which transport the lymph to its destination in the thorax. Along its path, the lymph passes through chains of small, oval-shaped lymph nodes where the fluid is filtered of foreign material. Once in the thorax, lymph is emptied into large veins at the base of the neck, and also just superior to the heart. Lymphatic fluid. Re-entering the bloodstream is essential for maintaining optimal fluid levels within the blood and cardiovascular system. See Table 5.1. Fat absorption. Lacteals are lymphatic vessels located in the lining of the gastrointestinal GI tract. They are predominant in the small intestine, where they pick up fats lipids, which are transported via the lymphatic vessels directly back into the bloodstream. Other nutrients in the small intestine are absorbed into the bloodstream and transported to the liver for processing. Immune function. As noted, immune system functions utilize lymphoid tissue and organs to produce the cells that fight and dispose of foreign material. Lymphoid tissue is composed of connective tissue and a variety of white blood cells, primarily lymphocytes. It is responsible for immune function, defending the body against infection and disease. Lymph nodes are areas of concentrated lymphocytes and macrophages, types of large phagocytic cells that engulf and ingest foreign bodies. Lymphoid organs include the thymus gland and bone marrow, which produce and store lymphocytes B and T cells, monocytes, and leukocytes until they are mature enough to be transported to the lymph nodes, tonsils, adenoids, and the blood. In the blood, they look for foreign material to destroy. B cells are produced in bone marrow, where they mature. They provide the body with its best response to bacterial invasion. The spleen filters or purifies blood and lymph. Musculoskeletal system. The musculoskeletal system serves as the body's framework. It is composed of the skeleton 206 adult bones, skeletal muscle, tendons, ligaments, joints, connective tissue, and cartilage. The skeleton is characterized as axial and appendicular. The skull, spine, and ribs form the axial skeleton. The appendicular skeleton consists of the bones that form the appendages, the frameworks for the arms and legs. Skeletal muscles give form and stability to the skeleton and enable it to move voluntarily. When you want to walk across a room, the brain commands the skeletal muscles to move the bones, and you walk. It is voluntary. Skeletal muscle is the only voluntary muscle in the body. Smooth muscle, located in the walls of the digestive tract and blood vessels, and cardiac muscle, found only in the heart, are involuntary muscles. Skeletal muscle is also called striated muscle because of its appearance under a microscope. Specifically, skeletal muscle cells are referred to as muscle fibers due to their long, thin appearance. In the body, skeletal muscle cells are arranged into the multiple bundles or fascicles that compose a skeletal muscle. Within each fascicle, a delicate connective tissue, the endomysium, surrounds each muscle fiber and interconnects surrounding muscle fibers to each other. The perimysium, also a connective tissue fiber, divides each skeletal muscle into a series of compartments, each containing a fascicle. In addition to collagen and elastic fibers, the perimysium contains blood vessels and nerves that maintain blood flow and innervate each fascicle. The perimysium and fascicles are enclosed by a dense layer of collagen fibers called the epimysium. The epimysium surrounds the entire muscle, separating it from adjacent tissues and organs. At the end of each skeletal muscle, the collagen fibers of the endomysium, perimysium, and epimysium come together to form a bundle known as a tendon, or a broad flat sheet called an aponeurosis. The tendons and aponeuroses generally attach skeletal muscles to bones. Where a tendon attaches to a bone, its fibers actually extend into the bone matrix, providing a firm connection. Consequently, any contraction of the skeletal muscle will exert a pull on its tendon, and thereby on the attached bone or bones. Different parts of the skeleton are joined to one another at connections termed articulations or joints. Joints are categorized as immovable, slightly movable, or freely movable. Articulations of bones in the skull are immovable, with adjacent margins almost touching. They are separated by only a thin fibrous membrane. The bony surfaces of slightly movable joints, such as the vertebrae, are connected by a layer of fibrocartilage. Adjacent surfaces of a freely movable joint, such as the hip and shoulder joints, are not as close, allowing for a greater range of motion. These margins are separated by the cartilage that covers the ends of the bones, which are enclosed by a fibrous tissue or capsule called a bursa. The interior lining of the bursa, the synovial membrane, secretes a fluid that lubricates the joint and reduces friction between the movable surfaces. Further, freely movable joints are made strong and held in position by ligaments, which connect the bones to each other. These are tough bands of elastic fibers that extend between the bones. Ligaments can be stretched to gradually lengthen and increase flexibility. To help prevent injury, most athletes perform stretching exercises that lengthen their ligaments to make their joints more supple. The muscles and skeleton work together to provide the body with vital functions, including movement, protection, hematopoiesis, and mineral homeostasis. Movement is produced when skeletal muscles contract to bend the skeleton at movable joints. Contraction starts when an electrical impulse from the brain reaches a motor nerve attached to each muscle fiber. The electrical impulse is transmitted in both directions along the muscle fiber, causing the different strands myosin and actin to shorten and slide past each other, producing a contraction. During contraction, the origin proximal tendon attachment of the muscle remains stationary, and the insertion distal tendon attachment moves. Protection, bone, and muscle provide protection from external forces. They form a protective covering for the vital organs, such as the bony calvarium over the brain and the bony rib cage surrounding the heart and lungs. Hematopoiesis, or blood cell production, occurs within the marrow of bones. Blood cells usually function for only 120 days before wearing out, at which time they break down into amino acids and other proteins and must be replaced with new blood cells. If the bone marrow is unable to replace the dying blood cells, as in cases such as leukemia or severe radiation damage, death would be certain if the urinary system did not provide an axis sorry function to the musculoskeletal system by assisting with the production of blood cells and secretion of the hormone erythropoietin, which stimulates bone marrow stem cells to manufacture more cells. This demonstrates how independent yet interrelating body systems support one another. See Table 5.1. In mineral homeostasis, when various parts of the body need certain minerals to maintain homeostasis, hormones are released that cause a chemical breakdown of bone, allowing it to pass calcium, sodium, and potassium into the bloodstream and thus transport the minerals to the necessary sites. See Chapter 3 for additional information about the muscular system. Reproductive system. The reproductive system is composed of primary and accessory male and female reproductive organs. In both, the gonads, male testes, female ovaries, are the primary organs. The main responsibility of the reproductive system is for the gonads to produce gametes, or reproductive cells, male spermatozoa, female ova, whose union initiates the production of new life. The reproductive system differs from the previously described body systems because it does nothing to directly contribute to the survival of the human body. It does, however, contribute to the survival of the human race. In a process called fertilization, the male and female gametes unite to form a zygote, which ultimately provides new life and perpetuation of human species. Production and maturation of male gametes. Spermatozoa are continually produced in the testes of the male reproductive organs. The pituitary gland releases luteinizing hormone, LH, to stimulate the testes, to release the hormone testosterone, which stimulates the production of sperm. See Table 5.1. Each testicle contains several hundred tubules where sperm production occurs. Testosterone is also the hormone responsible for male sex characteristics. The following accessory organs of the male reproductive system are the sites of sperm maturation and transport: epididymis, a long coiled tube located next to each testis, where spermatozoa mature and receive nourishment. Vas deferens, an extension from the epididymis joined by the seminal vesicle before becoming the ejaculatory duct. It serves to transport sperm from the epididymis to the urethra. Ejaculatory duct, the site where sperm mixes with nourishing, suspending fluids secreted from the seminal vesicles to form semen. The semen is transported through the prostate gland, where it receives more secretions, promoting sperm motility. It then enters the prostatic urethra and exits the penis via the urethra. Scrotum. The scrotum is the exterior sac of skin containing the testes. It is capable of protraction and retraction to maintain a constant temperature, which aids in the production of spermatozoa. The scrotum moves away from the body if the temperature is too high and retracts closer to the body if the temperature is too low. See Chapters 19 and 28 for additional information about the male reproductive system. Production and maturation of female gametes. Ova are produced in the ovaries of the female reproductive organs during the first half of the menstrual cycle, or approximately every 28 days, when the pituitary gland releases follicle-stimulating hormone, FSH. FSH stimulates the ovaries to produce ovarian follicles encasements, each containing an immature ovum, and to release estrogen too. Prepare the endometrium of the uterus for potential ZZYG implantation. The uterus is the normal organ site for a fertilized ovum to implant itself and where the developing embryo and fetus are nourished. It is located between the urinary bladder anteriorly and rectum posteriorly. It is muscular and hollow, with its cavity opening into fallopian uterine tubes bilaterally and into the vaginal cavity inferiorly. The accessory organs of the female reproductive system are the sites of ovum maturation and transport, and ovarian follicles, the encasements within which ova mature. And pituitary gland releases LH during the second half of the menstrual cycle, or approximately 14 days after follicle formation, to initiate ovulation and the formation and maintenance of the corpus luteum. Typically, only one egg, or ovum, will become mature enough for ovulation during each cycle. An ovulation occurs when the follicle bursts and releases the mature ovum. The corpus luteum, a glandular mass, forms from the now empty ovarian follicle. It begins releasing the hormone progesterone and a small amount of estrogen to further prepare the uterus for possible implantation of a zygote. The fallopian uterine tubes, long slender tubes that extend bilaterally from the uterus to the ovary on the same side, they are descriptively divided into the isthmus, ampulla, infundibulum, and intramural portions. The fallopian tubes transport the released mature ovum toward the uterine cavity. Fertilization may or may not occur along the ovum's course through the fallopian tube. If fertilization does not occur, no sperm and ovum encounter or union. The ovum degenerates and the hypothalamus of the brain instructs the pituitary gland to stop releasing LH. This disrupts maintenance off the corpus luteum. No more progesterone or estrogen is produced, and menstruation, the sloughing off of the non-implanted endometrial lining, begins. If fertilization does occur, the corpus luteum continues to be maintained and menstruation is suppressed. As the pregnancy progresses, the corpus luteum takes on a cystic composition. The hormone beta-human chorionic gonadotropin, BHCG, can now be detected via blood or urine for pregnancy testing. Fertilization. Fertilization usually takes place within 1 day of ovulation in the ampulla portion of the fallopian tube and is considered complete when the ovum and sperm fuse to form a zygote. The zygote repeatedly divides to form a cluster of cells called the morula, which exits the fallopian tube into the endometrial uterine cavity. Endometrial fluid enters the morula, creating a blastocyst, which implants itself into the prepared endometrial lining of the uterine cavity. Eventually, the blastocyst embeds itself within the uterine myometrium, completing implantation. Chapter 20 for additional information about the Fay pelvis, Chapter 21 for additional information about trimester obstetrics, and Chapter 22 for additional information about second and third trimester obstetrics. After implantation and organization of the blast cyst cells, an embryo formed. Over several works, embryonic cells multiply and undergo the beginning structural development. By the 9th week, organs formed and limb buds begin to enlarge to form the development of body systems continues along with growth. The respiratory system is the last system to of-ish development, which continues through the month shortly before birth. The excretory systems. Digestive system, urinary system, respiratory system. The body takes nutrients from the food we eat and uses heat to maintain functions throughout the body, such as saliva and energy restoration. Waste products are left behind blood and intestines after the body takes what it needs. The digestive, urinary, and respiratory systems work together to maintain the balance of water and chemicals in the body by excreting the waste. Digestive system. The digestive system includes the GI tract, or alimentary canal, and several accessory organs. The GI tract is basically a series of long tubes that begin with the mouth, followed by the pharynx, esophagus, stomach, small bowel, large bowel, rectum, and anus. The liver, gallbladder, and pancreas provide functions that aid in the digestive process. For additional information about these organs, see chapters 12 to 14. The main function of the digestive system is to convert ingested food into substances the body can use to maintain metabolism, the chemical reactions that occur in the body to maintain life. The mouth, esophagus, stomach, small bowel, and large bowel work together in the breakdown and absorption of food. Inside the mouth, the teeth, tongue, and salivary glands begin the process of breaking down food into smaller particles. The tongue pushes the particles through the pharynx and into the esophagus. The esophagus is a thick muscular tube approximately 10 inches long. It regularly contracts to push the food particles down and into the stomach. The stomach normally holds about a quart of contents. Its walls consist of folds called rugae that allow expansion and contraction. Between the rugae are glands that secrete gastric acid and mucus, which help break down or digest the solid food particles. The stomach churns to mix the food particles with the acidic gastric juice, and in 3 to 5 hours the food leaves the stomach and enters the small bowel as a thick liquid called chyme. The small bowel is approximately 7 minutes, 23 feet long, and is composed of 3 parts: duodenum, jejunum, and ileum. It is responsible for completing the digestive process through the release of its own digestive enzymes and absorbing substances such as nutrients and minerals across its surface area. The digestive process in the duodenum is assisted by the introduction of bile and pancreatic enzymes. The liver continually produces bile, a thick fluid that aids digestion by neutralizing stomach acid and breaking down fats. Bile is transported along the biliary tract to the gallbladder for storage, then on to the duodenum, where it meets with the pancreatic duct, carrying pancreatic enzymes. To enter the duodenum, through the ampulla of Vater, a small opening in the duodenum, and release the bile and pancreatic enzymes to assist in the digestive process. Digestion is completed in the duodenum and jejunum. Absorption of the nutrients and minerals from the digested food takes place in the jejunum and ileum and enters the bloodstream, which transports it to the liver. The remaining indigestible material is primarily fiber, cellulose, and a large volume of water. Peristalsis, a worm-like motion, moves the contents into the large bowel. The large bowel, or colon, is wider and shorter than the small bowel. It has 5 parts: cecum, ascending, colon, transverse colon, descending colon, and sigmoid colon. The large bowel is responsible for absorbing the remaining water from the indigestible contents, thus helping to maintain the body's fluid level, transporting the contents through the remainder of the colon and rectum, and finally carrying the residue to the anus to be expelled. Simultaneously, bacteria in the colon act on the remaining contents, which break down into a final solid waste called feces. Occasionally, the vermiform appendix, a small appendage of the cecum, becomes full and inflamed by indigestible material. This is commonly known as appendicitis, and in many cases is demonstrable with ultrasound. For additional information on the GI tract, see Chapter 18. Urinary system. The urinary system is composed of paired kidneys, 1 on each side of the body, paired ureters, 1 on each side of the body, the urinary bladder, and the urethra. The kidneys are bean-shaped organs about the size of an adult man's fist. Each kidney has its own artery, vein, and ureter, which pass through the renal hilum. The renal pelvis is a funnel-shaped reservoir that collects urine from all parts of the kidney and then empties it into the ureter, which transports the urine to the bladder. The bladder temporarily stores the urine, eventually expelling it from the body via the urethra. The main functions of the urinary system include the following: regulating blood volume and composition, regulating blood pressure, producing red blood cells. The urinary system regulates blood volume and composition by filtering waste from the blood that passes through the kidneys. This waste then becomes part of the urine, finally to be released from the body. Urine is composed of waste products including urea, ammonia, bilirubin, drugs, and toxins. Important substances such as water, salt, glucose, and amino acids that the body requires are reabsorbed. Blood pressure is regulated by the urinary system, which does so by controlling blood volume, adjusting the flow of blood into and out of the kidneys, and secreting renin, an enzyme that helps to control blood pressure. Further, the kidneys uniquely possess an additional capillary bed that affords them the ability to maintain a blood pressure equilibrium. Even when the systemic pressure changes as a result of problems within the cardiovascular system, see Table 5.1. The kidneys release erythropoietin, a hormone notifying the bone marrow to increase production of red blood cells when inadequate oxygen levels are detected in the blood. Kidneys. The kidneys are retroperitoneal organs, situated on either side of the spine, directly anterior to the deep muscles of the back, inferior to and behind the liver and spleen. Each kidney lies at a slight angle, with the superior portion closest to the spine. An adrenal gland is closely related to the supramedial surface. As urine collects in the renal pelvis of each kidney, it travels with the flow of gravity down the ureters, which are narrow tubes 20.3 to 25.4 centimeters, 8 to 10 inches long. They run between the renal pelvis and the urinary bladder, to both of which they are attached. The ureters enter the bladder posterolaterally. Each kidney contains about 1 million nephrons, or filtering units. Each nephron has a glomerulus, a cluster or ball of capillaries derived from an arteriole. The glomerulus is contained within a capsule called the Bowman capsule. It opens into a long, twisting tubule. The glomerulus releases water and dissolved waste from the blood into the capsule and then through to the tubule. Inside the tubule, glucose, salts, amino acids, and any other substances that the body might require are absorbed back into the bloodstream. What remains in the tube becomes urine. The urine flows through a series of collecting tubes, the renal pelvis that connects to the ureter, and on into the bladder. Urinary bladder. The urinary bladder is normally located in the midline of the pelvic cavity, in front of, or anterior to, most of the pelvic organs. It opens into the urethra inferiorly. It is a hollow muscular organ shaped like a balloon. The walls of the bladder stretch and become thin as it fills with urine. The bladder can hold up to about half a liter, 0.473 L, or 16 ounces of urine comfortably for 2 to 5 hours. At the level where the bladder opens into the urethra, there are circular sphincter muscles that close tightly around the opening to prevent leakage. Sensory receptors in the bladder send a message to the brain when the bladder is full and the urge to empty intensifies. Voluntary skeletal muscles can temporarily postpone emptying. However, at some point, the brain signals the sphincter muscles to relax, and the smooth muscle in the bladder walls tightens to induce urination, also known as micturition. The bladder expels the urine through the urethra, is discharging it from the body. A lack of voluntary control over the process is known as incontinence. For additional information about the kidneys and urinary bladder, see Chapter 15, Respiratory System. The respiratory system is composed of a long, unobstructed airway beginning in the pharynx and nos cavity and continuing through the larynx, trachea, bronchus, and lungs. The primary function of these structures is to sustain life by providing the means to supply oxygen to the blood while eliminating carbon dioxide, a natural byproduct of cellular activity. This is achieved when inhalation occurs. The diaphragm contracts, air enters the body via the nose and/or mouth, travels through the pharynx, and rushes past the larynx, down the trachea, and into the lungs. Within the lungs, air from the trachea passes into the main bronchi, which is subdivided into smaller bronchi and bronchioles that pass the air into the alveoli, where the exchange of gases, oxygen, and carbon dioxide takes place. Each alveolus is inflated by the air and forms a small sac lined with very thin tissue to facilitate the exchange of gases with adjacent blood capillaries. The muscular diaphragm relaxes, exhalation occurs, the diaphragm contracts, and the cycle of respiration continually repeats. How the respiratory system works is explained as follows. Air inhaled through the nose is warmed, filtered, and moistened as it goes through the nasal passages and into the pharynx. The pharynx is commonly known as the throat. It is situated posterior to the nasal cavity and superior to the larynx and trachea. Both air and food travel through the pharynx on their way to the trachea and esophagus, respectively. Food in the pharynx is prevented from entering the trachea by the epiglottis, a flap of connective tissue. The larynx lies between the pharynx superiorly and trachea inferiorly. It is commonly referred to as the voice box, a cartilaginous box with 2 pairs of membranes stretched across the inside. These are the vocal cords. When air passes the larynx, it vibrates the vocal cords, thus enabling us to make sounds. The trachea is commonly known as the windpipe, or main airway. It is 12 centimeters long and 2.5 centimeters wide and is held open by rings of cartilage within its walls. The trachea descends in front of the esophagus and bifurcates into 2 main bronchi that enter each lung. The bronchi are formed by division of the trachea and also held open by cartilaginous rings within their walls. They enter the lungs and branch out into smaller bronchial tubes, which divide and subdivide into tiny bronchioles. As the branches divide, they narrow and their walls become thinner, with less and less cartilage. The tiny bronchioles end at air chambers that resemble a bunch of grapes. Each chamber contains multiple alveoli, cup-shaped cavities that inflate with the inhaled air and exchange it for carbon dioxide from adjacent blood capillaries. Exhalation causes the alveoli to deflate, and reverse airflow expels the carbon dioxide waste from the body. Contained within the thoracic cavity, the paired lungs enclose the branching bronchial tree and alveoli. It is estimated that each lung consists of 300 million alveoli. The lungs, in turn, are enclosed by a double-walled SAC called the pleura, visceral and parietal pleura. These 2 sacs, with pleural fluid between them, enable the lungs to expand and contract without adhering to the chest walls. Each lung is somewhat triangular in shape, with its apex superior and base inferior. They are separated from the abdominal cavity by the muscular diaphragm, located at the margin of their base. For descriptive purposes, the lungs are divided into lobes, the right lung having 3 lobes and the left having 2. Computer imaging modalities such as ultrasound depict the body in cross-sections, using a variety of planes, and the images are reflected layer by layer. Thus, an analysis of body sections is essential to the recognition of normal tissue and vascular structures, and critical to the process of interpretation. We will study direction terminology, sectional planes, body divisions, and structural relationships beginning at the anterior muscle and organ layers, and moving posteriorly and downward from peritoneal structures to retroperitoneal layers, and finally to the pelvic structures and posterior muscle layers. Directional terminology and sectional planes, understanding the directional terminology that sonographers use ISCI to accurate descriptions and communication. Figure 6.1 is a diagram of the body in anatomic position with labels for directional vocabulary. Classic body planes are transverse, sagittal, and coronal, Fig. 6.2. Scanning planes used in sonography are the same as anatomic body planes. However, their interpretations depend on the location of the transducer and angle approach to the body. Transverse plane divides the body into superior and inferior sections perpendicular to the long, soft body. And sagittal plane divides the body into right and sections parallel to the long axis off the body from mid-sagittal plane. Coronal plane divides the body into anterior-posterior sections perpendicular to the sagittal plane and parallel to the long axis of the body from mid-axillary line or mid-coronal plane. Axial plane, a transverse plane that is perpendicular to a coronal plane. Body divisions. Sonographers must be able to differentiate the end cavities and spaces of the body, not only because of the bulk of structures they contain, but also because of potential abnormalities that can invade them. As seen as Fig. 6.3. The human body consists of two main cases, the dorsal cavity and the ventral cavity. Ventral cavity. Situated on the anterior ventral side of the body, the ventral cavity is divided into thoracic and peritoned. Figure 6.1 body loans in directional terms from Phaeton, K1, and Thibodeau 2016 structure and function of the body 115th Eddy. St. 2 Levier. 2. 1 coronal plane. 2 sagittal plane. 3 transverse plane. Figure 6.2 planes of the body produce different views. From Chabner D. 2020. Language of Medicine 12th ed. St. Louis, Elsevier. Cavities by the diaphragm, a muscular partition that assists with inspiration. The thoracic cavity, 2, is the enclosed area that corresponds to the ribcage, encompassing the chest. The peritoneal cavity, also referred to as the abdominopelvic cavity, is the largest body cavity, encompassing the abdomen and pelvis. It is lined by the peritoneal membrane, or peritoneum, a thin sheet of tissue that secretes serous fluid, serves as a lubricant, and facilitates free movement between organs. The peritoneum is classified as visceral and parietal. Unvisceral peritoneum is the peritoneum which covers the intraperitoneal organs. Parietal peritoneum is the portion of peritoneum lining the abdominopelvic cavity that forms a closed sac, except in females, in whom a portion of the fallopian tubes opens into it. The enclosed structures are termed intraperitoneal, and the structures located posterior to the SAC and covered anteriorly with peritoneum are termed retroperitoneal. Intraperitoneal structures include the following, which are attached to the cavity wall by mesentery double folds of peritoneum, stomach, ovaries, gallbladder, intestines, majority of, spleen, except hilum, and liver, except a bare area posterior to dome. Retroperitoneal applies to the following structures: kidneys, ureters, urinary bladder, pancreas, aorta, inferior vena cava, IVC, adrenal glands, uterus, prostate gland, ascending colon, descending colon, somatic nerves, duodenum, majority of, and lymph nodes, abdominal. The omentum is a double layer of peritoneum that extends from the stomach to adjacent abdominal organs. It is classified as the greater omentum and the lesser omentum. In some instances, there are folds of peritoneum running from one organ to another, called ligaments. The names of the ligaments are directly related to the organs to which they are attached. The greater omentum attaches to the anterior surface of the transverse colon. Ventral cavities: pituitary gland, thoracic, 2, diaphragm, abdominal, 3, pelvic, 4, 1, cranial, 5, spinal. Figure 6.3 body cavities. Ventral cavity includes the thoracic and abdominopelvic cavities. The thoracic cavity is an enclosed area that basically corresponds to the ribcage. It is separated from the abdominal cavity by the diaphragm. The abdominopelvic cavity extends from the diaphragm superiorly to the pubic bone inferiorly. Dorsal cavity includes the cranial and spinal cavities. The cranial cavity, calvarium, contains the brain. The spinal cavity contains the spinal cord. From Chabner D. 2020. Language of Medicine 12th ed. St. Louis, Elsevier. The lesser omentum attaches the lesser curvature of the stomach and first part of the duodenum to the porta hepatis, liver portion, where the hepatic artery and main portal vein enter the liver and the biliary ducts exit, also known as the liver hilum. The peritoneal cavity is divided into two spaces or compartments, the greater sac and the lesser sac. The neck, or area of communicate between the sacs, is termed epiploic foramen, or foramen of Winslow. And the greater sac extends from the diaphragm to the pelvis, covering the width of the abdomen. The lesser sac, also known as the omental bursa, is located posterior to the stomach. It is a diverticulum of the greater sac. Spock supracolic compartment, supramesocolic space, subhepatic spaces, subphrenic spaces, infracolic compartment, inframesocolic space, paracolic gutters, perirenal space, posterior cul-de-sac, pouch of Douglas or rectouterine pouch, anterior cul de sac, vesicouterine pouch location. The area above the transverse colon constitutes the supracolic compartment, which includes the right subhepatic space, left subhepatic space, right subphrenic space, and left subphrenic space. Classified as right and left because they are located posterior to the right and left lobes of the liver, respectively. The right subhepatic space includes Morrison pouch, which lies between the superior pole of the right kidney and the posterior aspect of the right lobe of the liver. The left subhepatic space includes the lesser sac, classified as right and left because they are located on each side of the falciform ligament, respectively. The spaces lie between the diaphragm and the anterior portion of the right and left lobes of the liver. The area inferior to the transverse colon constitutes the infracolic compartment, which includes the right paracolic gutter, left paracolic gutter, the gutter to the right of the mesentery, and the gutter to the left of the mesentery. The right paracolic gutter is located between the right lateral abdominal wall and the ascending colon. The left paracolic gutter is between the left lateral abdominal wall and the descending colon. The gutter to the right of the mesentery is a space between the mesentery and the ascending colon. The gutter to the left of the mesentery is a space between the mesentery and the descending colon. An area located around the kidney, adrenal gland, and fat, surrounded by fascia, Gerota fascia. Classified as anterior and posterior. The anterior pararenal space is located between the anterior surface of the renal fascia, Gerota fascia, and the posterior portion of the peritoneum. The posterior pararenal space is located between the posterior surface of the renal fascia and the transversalis fascia, the most posterior and dependent portion of the peritoneal sac. A space located between the urinary bladder and rectum in the male and the rectouterine pouch in the female. a shallow space located between the anterior wall of the uterus and the urinary bladder. This space all but disappears as the urinary bladder fills with urine. This space does not exist in the male. 1 in Table 6.1 summarizes additional peritoneal cavity spaces created by the complex arrangement of the peritoneum. These spaces are particularly appreciated sonographically when filled with free fluid. The abdominal cavity 3 or abdominal portion of the peritoneal cavity is bordered superiorly by the diaphragm, anteriorly by the abdominal wall muscles, posteriorly by the vertebral column, ribs, and iliac fossa. It is continuous with the pelvic cavity inferiorly through the pelvic inlet. Contents of the abdominal cavity include the liver, gallbladder and biliary tract, pancreas, adrenal glands, kidneys, ureters, spleen, stomach, intestines, and lymph nodes. Also included are the abdominal aorta and its branches, which supply blood to these structures, and the IVC and the main portal vein, which receive and remove blood from them. The left and right crura of the diaphragm, muscular bands that arise from the lumbar vertebrae and insert into the diaphragm, are also within the abdominal cavity. The pelvic cavity 4, or pelvic portion of the peritoneal cavity, is bordered anteriorly and laterally by the hip bones, and posteriorly by the sacrum and coccyx. It extends superiorly from the iliac crests to the pelvic diaphragm inferiorly. Contents of the pelvic cavity include the distal portion of the ureters, urinary bladder, urethra, distal portion of the ileum, cecum, appendix, sigmoid colon, rectum, lymph nodes, and iliac vessels. The pelvis is the part of the axial skeleton which links the lower extremities to the rest of the body through the lumbosacral spine. In addition, the female pelvis includes the uterus, fallopian tubes, and ovaries, and the male pelvis contains the prostate gland and seminal vesicles. The pelvic cavity is descriptively divided into the true and false pelves, which are based on an oblique plane in the pelvis, defined by the linea terminalis, an imaginary line drawn from the symphysis pubis around to the sacral promontory and marking the dividing plane. The circumference of this plane is described as the pelvic inlet. In true pelvis, the region deep to the pelvic inlet, also called the lesser pelvis or pelvis minor. 1 false pelvis, the area superior to the pelvic inlet and inferior to the iliac crests, also called the greater pelvis or pelvis major. Linea alba, external oblique aponeurosis of external oblique inguinal canal sternum, external oblique cut, internal oblique cut, transversus abdominis rectus abdominis inguinal ligament pubic symphysis. Figure 6.4 muscle layer, most anterior layer. From Grant A. and Waugh A., 2018, Ross and Wilson, Anatomy and Physiology in Health and Illness, 13th ed. Edinburgh, Elsevier. Dorsal cavity. Situated on the posterior dorsal side of the body, the dorsal cavity consists of the cranial cavity 1 and spinal cavity 5. The body layers. A valuable exercise is to imagine the internal structures layered like an onion. Shed the outermost layer by peeling the skin away as if it were an onion skin. Underneath the skin layer lies the anterior muscle layer. Underneath that layer is the organ layer, followed by a vessel layer and the posterior muscle layer. This section should help to differentiate the intricate relationships of internal body structures and reinforces the concept that familiarity with how anatomy is layered leads to easier recognition of the same anatomy in cross sections. Anterior muscle layer. Abdominal wall is the most anterior abdominal layer. Figure 6.4 extends from the xiphoid process of the sternum to the pelvic bones. Consists of subcutaneous tissue and muscles. 1 is subcutaneous tissue. Contains fat, fibrous tissue, fascia, small vessels, and nerves. Rectus abdominis muscle. Most anterior muscle of the abdomen and pelvis. Vertical orientation. Originates at the pubis and then ascends to insert at the xiphoid process of the sternum and costal cartilages of the 5th, 6th, and 7th ribs. Bilateral to the linea alba, a white line of connective tissue in the midline of peritoneal cavity. Organ and vessel layers. Liver. The liver is anterior to the pancreas, gallbladder and biliary tract, portal venous system, aorta, IVC, and kidneys. Figure 6.5. Horizontal right oblique orientation. Occupies the right upper quadrant and often extends across the midline off the body into the left upper quadrant. 1 intraperitoneal, except for a bare area that is posterior to its dome. Most anterior organ of the peritoneal cavity, and descriptively divided into right and left lobes. Right lobe, immediately anterior to the gallbladder, right kidney, primarily the superior pole, right adrenal gland, and head of the pancreas. Left lobe, immediately anterior to the stomach and body of the pancreas. Superior and lateral surfaces border the diaphragm, gallbladder, and biliary tract. The gallbladder and biliary tract, figure 6.6, are anterior to the portal vein, IVC, and right kidney. Right gallbladder, right kidney, gastroduodenal, artery, liver, duodenum, pancreas, head, left spleen, stomach, left kidney, inferior vena cava, aorta. Figure 6.5, liver, anterior to the pancreas, gallbladder, and biliary tract, portal venous system, aorta, inferior vena cava, and kidneys. Biliary tract. 1 intraperitoneal. Composed of right and left hepatic ducts, common duct, and cystic duct. Right and left hepatic ducts. Vertical oblique orientation. Bile-filled intrahepatic ducts that unitate the liver hilum to form the common duct. Common duct. Vertical oblique orientation. Descriptively divided into a proximal portion, the common hepatic duct, and a distal portion, the common bile duct. Common hepatic duct. From the liver hilum, it runs a short distance inferiorly, passing anterior to the right hepatic artery on its course to meet the cystic duct, which is connected to the gallbladder. From this level, the common hepatic duct continues as the common bile duct. Common bile duct. Courses inframedial, running behind a portion of the first part of the duodenum on its way to the head of the pancreas, where it meets the pancreatic duct. Either together or separately, the common bile duct and pancreatic duct terminate after they enter the duodenum. Cystic duct, vertical oblique orientation. A short duct that joins the gallbladder with the common duct, typically located adjacent to the cystic artery. Gallbladder, intraperitoneal. Orientation is variable, only the gallbladder neck is fixed in its position. Descriptive divisions are the neck, body, and fundus. Neck. The S-shaped curve situated above the body of the gallbladder that connects to the cystic duct. Body. Portion of the gallbladder lying between the neck and fundus. Fundus. Lower free, expanded end of the gallbladder. Often located anterior to the superior pole of the right kidney. Gastrointestinal tract. The gastrointestinal tract is anterior to the pancreas, figure 6.7. Stomach, vertical then horizontal orientation. Anterior to the diaphragm, spleen, left adrenal gland, superior pole of the left kidney, anterior aspect of the pancreas body and tail, and splenic flexure off a colon. Duodenum. Presents an unusual orientation. It is in the shape of an imperfect circle so that its termination is not far removed from its starting point. Inferior vena cava, figure 6.7. Gastrointestinal tract, anterior to the pancreas neck, just medial to the pancreas head, directly anterior to the superior mesenteric vein, inferiorly, and portal splenic confluence, superiorly, inferior to common and proper hepatic arteries. Marks the confluence of the gastroduodenal and anterior superior pancreaticoduodenal arteries. Pancreas body, just medial to the pancreas neck. Anterior to, in order of occurrence, the splenic vein, superior mesenteric artery, left renal vein, and aorta. Inferior to common hepatic and splenic arteries. Extends left laterally to the tail, and pancreas tail. Extends left lateral from the pancreas body to the hilum of the spleen. Anterior to the splenic vein and superior pole of the left kidney, typically inferior to the splenic artery. Portal venous system encompasses the superior mesenteric vein, inferior mesenteric vein, and splenic vein, which unite to form the portal vein, fig 6.9. This portal splenic confluence occurs directly posterior to the pancreas neck. Superior mesenteric vein. Vertical oblique orientation. Ascends from the small bowel, anterior to the uncinate process of the pancreas, and terminates posterior to the pancreas neck, where it joins the splenic vein to the P superior